Next in talk is, we'll have a talk about meditation and health by Dr. Rahul Mehrotra. So Dr. Rahul Mehrotra is Director and Head, Non-Invasive Cardiology, Max Super Speciality Hospital, New Delhi. He's the first prize winner for Best Oral Abstract Presentation at the world's first symposium on role of meditation in prevention and treatment of cardiovascular disease 2019 at All India Institute of Medical Sciences, Rishikesh, Uttarakhand, India. He's also the winner of EcoCardi Quiz at the World Congress of Cardio Eco 2017 at Birla Institute of Scientific Research, Jaipur. Dr. M. Chenna Reddy Award and a gold medal in cardiology by the Vice President of India for Best Research Paper at Raj Epicon, Jaipur. Let me extend a warm welcome, a flowery welcome to Dr. Rahul Mehrotra. A big round of applause, please.
So very good evening. I've been practicing meditation since I completed my MBBS, soon after my graduation. And had this kind of a session happened in our institute when I was in the first year, now I can say that I too would have started meditation much earlier. Because practicing meditation for 20 years now, I can feel the benefits that I have got during my studies as well as daily life. So I often feel very excited when I get the opportunity to share this with the student community, because those are the years where we need to work hard, we need to study, spend sleepless nights, but at the same time we need a lot of answers to vexing questions of life, and we have a lot of stress. So for all these reasons, I think formative years, the ones you have in your college, are one of the best time for you to start the practice of meditation. Since I have been practicing meditation for 20 years now, and I can speak from experience. So none of these are borrowed slides. This come from my heart, based on my own experience. So a word about yoga. You've heard this word. How many people know what yoga is? Please raise your hands. So yoga is a Sanskrit word which means to join. In English, in mathematics, you would call it sum of two things. So yog means to join. But then immediate question comes, to join what and how? So yog means to join the individual entity in the individual soul with the ultimate soul or the universal soul, what we call. You may like to call it God. So when we become one, the drop merges with the ocean. That is yog. So yoga is a final outcome, but it is being used, the term is being used very loosely, and anything and everything is being marketed now in the name of yoga. And it is almost become yoga now, rather than being yoga. So the Sanskrit word defined is yajute anena iti yoga. This comes from the Gita. One that joins is yoga. So one that joins the individual with the ultimate is yoga. And clearly we cannot have yoga by just doing physical bodily exercises. That is what we call asanas. Next slide, please. So this was the definition of yoga, and everybody agrees that this is what yoga should mean. So I think most of us should be clear about what we mean when we say yoga, and we should question our seniors, our adults, our teachers, if they talk about yoga and we have queries related to yoga. Next slide, please. So this is the eightfold path, or the Ashtanga Yoga, which was given by Sage Patanjali more than 2000 years ago. And these are the practices which we enumerate. On the left side is what you see are called the Hatha Yoga, or the bodily exercises for keeping the body fit so that we can practice the Raja Yoga, which is the mental exercises. The first step is going inwards. Previous slide. So Dharana, Dhyan and Samadhi means going inwards, developing focus and sam adi means become one with the original condition. Adi state means the original state before creation which we had. So to become one is the aim. And all these practices help us do that. And meditation is one of the final steps, the 7th step. And what I have been practicing is the heartfulness way of meditation, which straight away takes us to the 7th step, and the other steps we need not to worry about because they fall in place on their own. So this is another shortcut that we have in this practice, because most of us don't have that much time to first practice asanas and then do pranayams for some time, and then by the time meditation we come to, we have already time to rush to whatever we have to do. So what is meditation? Meditation is the 7th limb of Ashtanga Yoga. But what is meditation? How do we define meditation? Anybody has any definition of meditation? I would request you to keep your eyes above your mobile phones. Let India, England battle it out. We have a battle of life to fight in the years to come, and this is something which will help us. Whatever Virat Kohli does is not going to help me or you. Anybody knows what meditation is? How do you define meditation? Dhyana you would have heard. So is it just closing your eyes, trying to focus on something? Is it more than that? So this is something which you have to experience. You're right that you cannot define it. Maybe most of you know it, but you cannot spell it out in words, because most good things cannot be just described. They have to be experienced. And meditation is something that we need to experience. So just to give a definition, because we need to define things when we need to study things, we need to do studies, we need to tell somebody else. So meditation has been defined in several ways, but this is an accepted definition given by sage Patanjali also, and which we also follow. Next slide, please. So if you work very hard at focusing, which you do when you study, we call it concentration. If you put in a lot of effort and still you are not able to focus, you get frustrated. And what all of us are doing are randomly doing things without any focus, and that is why we are daydreaming. I want to become something, I want to start up something, I want dream to become something, and without any effort directed at that. So that is what is daydreaming. So what meditation is, previous slide please. Meditation is defined as effortless focus. You need not to do any effort, yet if you get focused, then that is meditation. Next slide please. So coming to the topic of health, being a doctor, I have to be talking about health, and that is the topic. So this is where the great scientists of the olden days, more than thousands of years ago, the scientists and philosophers were one in those days. They've talked about medical science, and they believed that science and philosophy, medicine and health and philosophy were one. They did not have systems like we have today, cardiologist, orthopedician, pediatrician. We treated the human body as one because we believed our thought process affected the entire body. What we think affects our health. So most of the medicine was centering around philosophy. Next slide please. And this is where again science is coming back to. In medical science, a lot of research is happening now, and we have learned that meditation not only helps heal the body, but it also is very useful for mind. Focus, concentration, attention span, something that you people want to develop, is also possible with this act of meditation, and simultaneously we are also assured of good health if we are regularly meditating. Next slide please. And all this is coming out of scientific data. Why I am here and why I am trying to distract you away from the interesting cricket match is because of this thing. The major cause of death today is not COVID. It never was. neither is it malaria, dengue, or pollution, whatever the newspapers may say. The commonest killers of our times are these non-communicable diseases. And the other name we have for these non-communicable diseases is lifestyle diseases. No bacteria, virus, or neighboring country is responsible for causing these diseases. It is because of our own faulty lifestyles that these diseases are coming to us. And if you people are in an age where most likely there's a 70% chance that your parents, your colleagues, your neighbors, and you yourself will succumb to one of these lifestyle diseases if we didn't change the course of our lifestyle right now. Because even in countries like India and even in African countries, these are the leading cause of death. So what is the leading cause of death amongst lifestyle disease? Heart disease. Number 2, cancer. Number 3, lung diseases, diabetes. So a US Surgeon General, like we have health specialists in our country, the Surgeon General of US is the highest authority of health. He had a very good statement to say. He said that the mankind is doing a good job of killing itself. So if we are becoming extinct few hundred years from now, no one else will be to blame except for our faulty lifestyles. And a major culprit is right in your hands, in your pockets right now. This digital addiction is also being proven to be a major cause of cancer. It is already being listed as potentially carcinogenic, potential to cause cancer, radiation from mobile phones. So our lifestyle is the reason why so much patients of heart disease, cancers, lung disorders are happening right now. But the best news is these are all reversible and preventable diseases. And the answer lies in improving our lifestyles. Next slide, please. So where does meditation come in all this? So I'll show you some slides, very quickly go through them. I know it will be boring for you to have those data related to medical science, something that you're not interested in. So where does meditation fit into the health frame? Next slide, please. This is what we show as risk factors for heart attack. When somebody has heart attack, we know that 1 out of these 9 factors have to be present, or multiple risk factors out of these. 7 are modifiable risk factors: lack of exercise, too much stress, faulty diet, cigarette smoking or tobacco in any form, overweight or obesity, high blood pressure, abnormal cholesterol. All these are modifiable by having a good lifestyle and avoiding these risk factors. Next slide. And this is how meditation is shown, and this is from textbook of cardiology. How just by meditation with the brain, we are able to change the hormones in the body, and ultimately it translates into less heart disease and less brain diseases. So clearly now, science has come to the conclusion that meditation will ultimately result in, over a long period of time, less number of heart attacks, less heart disease, apart from other lifestyle modification that we all should do: regular physical activity, taking care of our diet, avoiding overeating, or maintaining our body weight to a healthy level. Next slide, please. And these are some of the, quickly I'll take you through because this is an alien world to you. You people are dealing with numbers, technology. This is the world of medicine. And now American Heart Association has given this statement almost 4 years ago that meditation is proven to be a tool for lowering blood pressure. It is as effective as any drug and as effective as salt restriction, physical exercise, and other recommendations that we have been taught when we were studying. But now it says that we should talk about meditation to all patients of high blood pressure. And even if you don't have blood pressure, if you incorporate meditation into your daily practice, you will have lesser blood pressure as compared to non-meditators. Cigarette smoking. Every day I come across patients and young heart attack patients. The youngest heart attack patient I've treated is a 24 years old boy, came from outside Delhi, got a job in Delhi, Within 2-3 months of his job, he got a heart attack. He came in my night duty, survived a life-threatening heart attack. We saved him. He was crying the next morning. When I told him, "Are you smoking?" He said, "Yes." "How do you know?" 90% of young heart attacks, young means less than 40, occur because of cigarette smoking. He was crying and he told me, "Don't tell my mother." अभी अभी जॉब लगा था, पार्टी करने जाते हैं तो स्मोक और ड्रिंक, पार्टी का मतलब ही यही होता है. Friends started smoking, I also started smoking. But he had one question for me. सर, शाहरुख खान तो 20 साल से सिगरेट पी रहा है, उसको हार्ट अटैक क्यों नहीं हुआ अभी तक? So these are our role models in our country. And these are the problems we are battling with in our healthcare sector. And I get patients every now and then who are trying very hard to quit smoking, and it is not possible for them to get rid of this habit. So how to quit smoking? It is in the software of the brain. हार्डवेयर से आप सॉफ्टवेयर को ठीक नहीं कर सकते, ये तो मैं बायोलॉजी वाला भी जानता हूँ, राइट? आप लोग तो इंजीनियरिंग के मार्वल्स हो. सो वी नीड सॉफ्टवेयर टू करेक्ट सॉफ्टवेयर. Faulty habits, faulty thinking can only be molded by modifying our brain, modifying our thinking. And this remarkable tool of meditation is showing the way forward for this. We have a Government of India project under Ayush Ministry going on for de-addiction programs centered around meditation. And this was a wonderful study. Just 5 hours total of meditation was given to subjects, and we demonstrated 60% quit rates. 60% people were able to quit smoking after they were given just 2 weeks or 5 hours in total of meditation experience. Because it acts on the brain, helps us get rid of habits. Next slide, please. A major pandemic going on before the COVID pandemic came on was stress. We call it the silent pandemic. Nobody talks about it, no newspaper, because this is a boring topic. But this has been eating away the society silently. All of us are stressed. I see young school students stressed, parents, tremendous stress, college students under stress, retired people stressed. Why? Because of different reasons. And stress is a risk factor you saw in the list, as powerful as smoking or diabetes or hypertension. It is a soft risk factor, but equally powerful for causing heart attack. आपको पुरानी मूवी याद होगी, वो नासिर हुसैन की, वो एक बुरी खबर मिलती है और उसको हार्ट अटैक हो जाता है. It is true. We get patients now and then. I got a 30-year-old girl recently with heart attack because her father had died, the only earning member of the family, and she could not take that stress. Being the eldest daughter, she had a heart attack. So these are cases in point you people don't get to see because they come in the hospital, go out again from the hospital. So stress is a very, very powerful risk factor, and which is increasing enormously. So this was a study done with heartfulness meditation in a hospital in the US, where we offered this practice to half people, doctors, nurses, paramedical, because hospital is a very stressful environment. And half people were not given this meditation. After 12 weeks, we studied them and we showed that those who meditated had less stress, less anxiety, less anger, less cynicism as compared to those who were not meditating. And this was a study published in the journal in the US. Next slide, please. And this is a picture from the Mayo Clinic, one of the top 5 hospitals of the world. And if you visit stress management on the web portal of Mayo Clinic, you will find meditation under tests and procedures. So they are treating meditation as a procedure to reduce stress. Very unfortunate that something which we gave to the world, meditation, is coming back to us from the Western world. They have already given us this status of a practical and scientific tool. They don't laugh at meditation, they don't ridicule it, they practice it because they have proven the benefits of this system. Next slide, please. This is a snapshot from the European Journal of Cardiology, which is again studied 37 studies on yoga and proven that yoga and meditation are equally effective in lowering blood pressure, blood sugar, cholesterol. And the bottom line is, no difference was found between yoga and exercise. It is as effective as any other gymming exercise that you would be like to doing, because it is more fanciful. We've taken to gymming and we laugh at yoga asanas. Next slide, please. This is a study from Africa. 200 patients of heart attack and stroke. After discharge, half were given meditation, half were only given advice related to diet, regular walking, and regular drugs. So those who were given meditation at the end of 5 years had 50% less occurrence of a repeat heart attack or a stroke. Such powerful intervention. And these studies coming from Europe, America, Africa. Where are we in our country just claiming to be innovators of meditation, have given the world yoga and meditation, but are we practicing it? Are we utilizing what we have in our homes? It is something which is our own heritage. But again, it is coming back to us from the Western side, so we are all embracing it now. Next slide, please. So this is because agar American Heart Association का stamp लग गया तो we all respect it. So this is an AHA scientific statement, American Heart Association scientific statement. What does it say? Looking at all the researches that have been done across the world, they recommend meditation as a tool for reducing heart disease. So I am no longer ashamed of telling my friends that I meditate, because earlier when I used to say मैं meditation कर रहा हूँ, कि क्या problem हो गई? Meditation क्यों कर रहा है? My in-laws were very scared that I will run away to jungles, I will not be interested in earning money if I meditate. But now I am proud and I openly share with everybody, because this is a very much scientific tool. And we are chided by the health authorities to recommend meditation to all my patients, and which I do. Next slide, please. On sleep, something of your interest. Most of us don't like to sleep. At your age, I considered sleep as a waste of time. 24 hours में से 8 घंटे सो गए तो 1/3 लाइफ तो सोने में ही चली जाएगी. उतनी देर में कुछ अर्न कर लें या कुछ पढ़ाई कर लें तो बेटर होगा. So we used to sacrifice our sleep for studying and doing other things. Nowadays you are sacrificing on mobiles and watching other stuff on your screens. But a major problem which is seen by us in hospitals is lack of sleep. Earlier, elder generation used to complain, Doctor Sahab, neend nahi aati hai, and everybody used to have sleeping pills. Now even younger generation is not able to sleep. Others are also not able to sleep. Those who are well off are not able to sleep. Those who have not so well off are again also not able to sleep for several reasons. Sleeping pills are not the answer. They have numerous side effects, addiction liability, abuse potential, and we get tolerance in the sense that we don't respond. After some time, the same drug is not acting at all. Meditation has proven scientifically to be a very good tool to help us sleep easily, to have very restful sleep. Even if you sleep for a shorter duration, you wake up much more fresher as compared to any drug available. And of course, no side effect. All this is based on scientific data. Next slide. So this is a functional MRI study. We can study the brains of the people when they are sleeping and when they are meditating. So this was shown that just 10 minutes of meditation and the brainwave pattern immediately changes. From chaotic activity, 10 windows open on your mobile, same thing happens to our brain when we are rapidly thinking of so many things. While if we start meditating, it becomes a very harmonized brainwave pattern, which enables us to fall asleep very effectively. And one who sleeps better does better in life. There are numerous studies in school students which prove that academic scores are directly related to sleep. Next slide, please. So for brain and thinking, as I mentioned, software. This is the greatest tool that we have, and because of this, you are here in this premier institute. Because of the excellent software that you have, your brain, your mind. But unfortunately, we have not been utilizing the full potential of the mind. You know what Einstein had said. we almost end up using only just 20% of our brain, maximally. 80% goes unutilized. And meditation is a tool which can allow us to harness that immense potential that we have. And it is being used in healthcare sector for different neurological diseases like pain management. Sometimes we have cancers where terrible pain happens and no drug is effective. So we've seen good effects of meditation in that. Anger management, all of you must be dealing with. We have seen disasters happening due to short-term anger. A lot of losses happen due to anger. And no need to spend money, no need to take drugs, no need to go to Madhushala for managing your stress. It is best managed by this safe, very effective tool, meditation. And all this is born out of scientific literature. All this is taken from publications in scientific journals. Next slide. Next slide, please. So this was a study which we did. I think it will be of interest to you in collaboration with IIT Delhi, National Resource Center for Value Education at IIT Delhi collaborated with us. I was one of the participants from the Max lab, and we did this study in our Echo lab where I was in charge. We invited 30 heartfulness practitioners to our lab. Every day one practitioner we used to study when they were doing meditation. And we have this practice in heartfulness which we call rejuvenation or cleaning. शाम को जाके सारा अपना जो दिन भर का इकट्ठा हुआ है उसको वाइप ऑफ कर देते हैं. कंट्रोल ऑल डिलीट या परसेंटेज रन, एवरीथिंग जो बैकग्राउंड में सेव होता है हमारे सॉफ्टवेयर में, everything is removed. It's a very effective tool and a wonderful tool. So we studied with ECG monitor. We should hook them with an ECG monitor on their chest. As they are meditating for 30 minutes, as they are doing cleaning for 30 minutes, and we compared it with 30 minutes sitting quietly, closing eyes. And we demonstrated that meditation and cleaning resulted in significant change in their ECG pattern. And their ECG pattern switched over from sympathetic activity to parasympathetic activity, which is very useful for good health. Next slide, please. So this was the first of its kind study from our country. Keep moving forward, please. Widely popular in the media. First study, scientifically studied, published in the Indian Heart Journal, the premier cardiology journal of the country. Taken up across the country because for the first time we were able to demonstrate scientific benefits in just 30 minutes of meditation and cleaning. And this was scrutinized by scientists from across the globe. And when we presented this research paper at the world's first conference, next slide please. This was a cover issue of India Today magazine. For the first time in our country, we were talking of science of meditation without Babaji pictures being on the screen. It is a very scientific aspect and this was proven. Next slide. So we presented the abstract and the research findings from amongst more than 400 publications from across the globe, different types of meditation. And this research paper won the first prize for best research paper amongst the evidences for science and meditation. Next slide, please. Next slide. So I'll conclude my presentation. I believe last over is coming up. So what is health? Health is a take from the Sanskrit word swasthya. The oldest language in the world had a word for health, which is swasthya. And swasthya literally means जो स्व में स्थिर है वो स्वस्थ है. So if you are centered in yourself, then you are healthy. So being centering in yourself is possible only through meditation, and that is what we do when we meditate. We go inwards towards our center in our heart and we meditate. So being healthy is being meditative throughout the day. With that, I'll conclude the presentation and thank you so much for your patient listening. I come from a different planet. Thank you so much. I expected you to treat me like an alien, a biology student coming to an engineering college. So thank you so much for a patient listening. But the best would be experience this, see for yourself, experiment with it. with a very scientific temper. If you feel something, follow it for some time, see whether it is helping you, bringing changes in you, and then either take it forward or reject it. But give it a fair trial, please. Thank you. Thank you so much.